Welcome to our webinar on using the Message Center on TRICARE4u.com. In this webinar, we will explain how you can send secure emails to TRICARE for Life in the Message Center. The TRICARE4u.com Message Center is a secure email system that works just like regular email, but is self-contained within the portal. We call it Webmail. In the Message Center, users can communicate with TRICARE for Life via email in lieu of phone or postal mail, create and send webmail messages, receive and read webmail message replies, and submit attachments and claims in your webmail messages. Webmails are HIPAA compliant and secure. Webmail messages are handled in a manner similar to letters, but replies are sent via webmail. The benefits of using the Message Center include: you will receive fewer or no phone calls. You can submit inquiries more efficiently. You can access Message Center 24/7, 365. The Message Center is HIPAA compliant and secure. It eliminates hassles of photocopying, postage, and mailing. You can avoid waiting for postal mail to receive a reply. You can download and print forms and correspondence. Replies and follow-ups are grouped together for convenience. And webmails are saved in your account. You must have a registered user account to communicate in the Message Center. Once you log into your personal user account, click the Message Center tab in the blue banner bar. In the Message Center, you can see a collection of your past webmail messages, their status, subject, and age. You can also create a new message or submit a new claim. Let's start by creating a new message. To do so, just click the Create New Message button. Once you click the Create New Message button, the new message screen will launch. There is a general instructions paragraph, but also a helpful link labeled These Easy Steps. We will go through the easy steps in the next slide. These are helpful to have in case you encounter a problem trying to submit your inquiry. Please review and follow these steps to submit your questions. The From field will be auto-populated with your email address. If the address from your profile is incorrect, please use the Edit Email link to provide the correct address. Choose a subject from the drop-down list. If none of the subjects listed seems to fit your inquiry, please choose General Question. If your question is related to a claim, please choose Question About Claim. If you don't have the claim number, choose I Don't Know It. You will then be able to provide the date of service, billed amount, and patient information for the claim in question. We will need this information to locate your claim. If you have an attachment to submit, for example, supporting documentation, claim form, medical records, etc., please select the Browse button to locate the attachment on your computer. Please note the system requirements for types of files accepted and maximum file size. Add your question or comments in the Comments box. Please explain the issue as clearly and concisely as possible and provide all relevant details to help us understand your question. Then, click Send. You will receive an email from us when customer service has replied to your inquiry. Please do not reply to the notification email. Log into your secure TRICARE4u.com account to read the reply. If more information is needed, please send a reply from your secure account. When you click to create a new message, the form will launch with the email address from your profile already populated in the form. Please be sure to verify and update your email address if necessary. Now, click on the subject field or the drop-down chevron to select the general subject from the choices in the drop-down menu. Depending on the subject, some selections will add a paperclip or add a file function, allowing you to submit attachments. Please note, you must already have your documents saved on your computer before you use the attachment button to search for them. Enter your first name and date of birth. These are required fields under HIPAA. Next, in the large rectangle, type in your inquiry and add attachments if necessary. Once you are done, click Send. Once TRICARE for Life staff have replied to your inquiry, you will receive an email notification that you have a reply. You will be asked to log into your user account to read the reply. Click the underlined subject of your inquiry to open the reply. Here's an example of what you would see when reading your Webmail inquiry and reply. If you need additional information and want to ask follow-up questions, you can reply by typing in the Message to Send box, then clicking the Send button. If needed, you can also use the Choose File button, the paperclip symbol, to attach documents. In most cases, your provider will file your medical claims for you, and you will receive an explanation of benefits detailing what was paid. Sometimes you'll need to file your own claims. You may need to file a claim yourself if you are traveling, you get care from a non-participating provider, you're using TRICARE for Life and you see a non-Medicare provider, your provider of service does not file to TRICARE for Life, TRICARE for Life is your third payer, and your provider will not file to more than 2 insurances or health coverages on your behalf. This list is not all-inclusive. These are examples of some of the more common reasons you may need to file your own claim. This is an example of the File a Claim page you will see after you click the button to submit a new claim. We will look at this process in more detail just a little later in this webinar. You will need a claim form to submit for reimbursement of medical expenses. TRICARE4u.com does have a Forms section in the Resources area. To make it even easier for you to access needed forms, we place links to specific forms in relevant areas. After you have clicked the button to submit a new claim, you will be on the Claim Submission Inquiry page. On the top of the page, there are some instructions for filing a claim. In those instructions, there is a link to get the claim form. To download a DD Form 2642 Beneficiary Claim Form, click the Download button. Complete the form and save it to your computer. Be sure to use the Save As command. You will need to have this completed form saved as a document on your computer in order to upload it using the File Attachment feature. Officially, it is called a TRICARE DoD Champus Medical Claim Patient's Request for Medical Payment. You may hear us refer to this as the DD2642 Beneficiary Claim Form. You must complete, sign, and submit a DD Form 2642 with any new claim you submit. Note, if you are using the Message Center to only submit requested documentation for a claim already on file, then the DD2642 is not needed. Additional or requested documentation may include the primary health insurance explanation of benefits, medical records, or DD Form 2527, potential for third-party liability. Let's look at some claim filing tips. On the File a Claim page, there is a link to filing tips. Please take a moment to review those tips before submitting your claim. If something is left out or missed, it may affect or delay processing your claim. We recommend you keep DEERS updated. This facilitates your claim processing. Use the correct form. Your claim may be returned if not using the correct form. When filling out the DD2642 claim form, be sure to fill it out completely. Use the correct diagnosis code from your provider to avoid claim delays. Sign the form. Your claim will be returned if the DD2642 form is not signed. Notify TRICARE for Life if a third party is involved. If your claim is for care from an accident or injury potentially caused by someone else, you will need to complete an additional form. If you have another insurance besides TRICARE for Life, file your claim with your other health insurance first. By law, most OHI is first payer, including Medicare. After your OHI processes your claim, you can then file with TRICARE for Life and provide the OHI EOBs. Keep copies of all your documents. If mailing your claim instead of using the message center, be sure to use the correct address. WPS TRICARE for Life, P.O. Box 7890, Madison, Wisconsin 53707. File your claims on time. You have 1 year from the date of service for outpatient claims, or 1 year from the date of discharge for inpatient claims, to file your claim with TRICARE for Life. If you are going to submit multiple claims, be sure to submit each claim separately. To file a claim in the Message Center, check the accuracy of your email address that we have on file and update it if necessary. Use the subject New Claim. Enter the first and last name of the patient. Enter the beginning and ending dates of service. Enter the total billed amount. Using the Choose File button, the paperclip symbol, attach your DD2642 claim form and supporting documents. Enter your text message and click Send. After you click Send, you will receive an email in just a few moments confirming the transmission to us. Please do not reply to this email. It is merely a notification. Your Webmail claim is received, reviewed, and either entered into processing, or, if more information is needed, we may send a reply requesting more information. Please allow approximately 30 days from the time you submit your claim form to the time you receive your explanation of benefits or email notification. You can monitor your claim under the Claim Activity tab of your account. If you have elected to receive an email notification when your claim has processed instead of a paper EOB in the mail, you will receive an email that the claim has processed. The email instructs you to log into your user account to review the claim details and/or the explanation of benefits within the Claim Activities section. There is no need to print out the EOB unless you need it. EOBs are available in your online account for 2.5 years after the date of service. This concludes our presentation. Thank you for watching. We hope you enjoyed the presentation and found it useful. Please follow and like our social media pages on Facebook, Twitter, and YouTube.